All, I request everyone to please switch off their mobile phones and please register from the QR code presented here if you haven't already. Thank you. We'll begin shortly. Hello everyone. Even if you have registered outside, please register again using this QR code. Thank you. A very good afternoon and hearty greetings to all present here today. I'm Zikra Sayed from Postgraduate Diploma in Dietetics and Applied Nutrition, delighted to deliver this inaugural segment for today's beautiful seminar on PCOS, health and wellness. Today, we embark on a journey that embraces the harmony between mind, body, and spirit. In a world where health often focuses on physical fitness alone, we will explore the deeper connections that fuel our well being, nurturing not just the body, but also the mind and soul. Together, we will discover practices and insights that inspire balance, vitality, and a renewed sense of wholeness. Let's begin this transformative experience towards a healthier, more fulfilled life. Before we progress, let's begin this beautiful session by seeking blessings from the divine that always guides and sustains us through the significance of lamp. I would hence request our in-charge principal, Professor Dr. Vishakha Karnar, Manager Ms. Noella Dias, Head of Department Ms. Vibha Hasija, Founder President of PCOS Society India, Dr. Duru Shah, Convener and Director of Self-Finance Courses, Dr. Yasmina Avari, Convener of Wellness, Fitness and Holistic Health, Ms. Fatima Kadir, Convener of Women's Development Cell, Professor Dr. Kamini Rege, and one student representative to please come forward for the same. Thank you, everyone. I would now like to invite our in-charge principal, Professor Dr. Vishakha Karnar, Manager, Ms. Noella Dias, Head of Department, Ms. Vibha Hasija, Founder President of the PCOS Society India, Dr. Durusha, Convener and Director of Self-Finance Courses, Dr. Yasmina Avari, Convener of Wellness, Fitness and Holistic Health, Ms. Fatima Kadir, and Convener of Women's Development Cell, Professor Dr. Kamini Rege, to please be seated on the dais. Let us now take this wonderful seminar ahead with a beautiful prayer. I would hence like to invite our manager, Ms. Noella Dias, to please lead us for the same.
Good afternoon, everyone. And today we are privileged to have Dr. Durusha and her team, and also all the students present here. We shall ask Lord to bless each one of us. See, the topic they are going to handle is PCOS. Many girls, when they come to meet, they express their distress and frustration that they are having so many issues with their health. So today is the right time to ask your questions and get the help for all the difficulties you go through. Now we ask Lord to bless this event and bless each one of us. We are women, and God has given us beautiful body. God created woman little different than a man. Correct, no? So, some additional parts God has given us. So those organs helps us to procreate and give birth to a new human being. So we ask Lord to bless our body, bless each one of us, and ask Lord to empower us, strengthen us. So just pay attention. I invite you, kindly take a proper posture and get in a prayerful mood.
But I'm ready to fight. Uncover my story, step into the light. Who am I? I'm a dreamer reaching for the sky. With every heartbeat, I'll let my spirit fly. Who am I? I'm the hope that never dies. With the strength inside me, I will arise. Every scar is a chapter, every fall is a chance to learn from the struggle, to join in the dance. I'll break through the silence, let my voice be heard. With courage as my compass, I'll soar like a bird. Who am I? I'm a dreamer reaching for the sky. With every heartbeat, I'll let my spirit fly. Who am I? I'm the hope that never dies. With the strength inside me, I will rise. I'm a flame in the darkness, spark in the night. I'll follow my passion, let it guide me right. With every step forward, I'm writing my song, embracing the journey where I truly belong. Who am I? I'm the dreamer reaching for the sky. With every heartbeat, I'll let my spirit fly. Who am I? I'm the hope that never dies. With the strength inside me, I will rise. So here's to the future with my head.
So we will rise and fulfill our dream. Correct or not? Yeah. So thank you, ma'am, for coming to this organization and helping our students. And so thank you for your presence. And we ask Lord to bless her and her team and her work she's doing for women empowerment.
Thank you, Noella ma'am. I would now like to invite our in-charge principal, Professor Dr. Vishakha Karnar, to please deliver the welcome address.
So the College of Home Science, Nirmala Niketan is the only home science college which is affiliated to the University of Mumbai. We are accredited as the A+ grade under NAC. The aim of our college is to provide education which is life-oriented, career-oriented, and community-oriented, empowering young women who can take care of themselves and the society. My dear students, your health can affect your performance and will directly impact the well-being of our society. So we want you to be aware and alert of your body, health, and safety. Polycystic ovary syndrome, PCOS, is a hormonal disorder with many symptoms of abnormal menstruation, with many symptoms of weight gain, leading to infertility, skin and hair issues, depression, and it can affect psychological, mental, and social wellness. World statistics show that around 22.5% of females facing PCOS have resulted in infertility. I'm glad that the Department of Foods, Nutrition and Dietetics and the Committee of Wellness, Fitness and Holistic Health and Women's Development Cell together under the aegis of the IQAC have collaborated with Vijayata for this awareness program of the PCOS Society of India. We welcome our keynote speaker, Dr. Durusha, our panel members, Dr. Sabita Bhale Rao, and we have a complete panel of a nutritionist, mental health expert, an endocrinologist, a fitness expert, gynecologist, and a dermatologist, all put together, dear students, for you to make the most of this interaction, to make and take tips from all these experts here. I thank the management, Ms. Noella Dias, the conveners of the different committees, Dr. Avari and Ms. Vibha, the heads of departments of the self-financed and the aided programs. So make the most of this session, dear students, and we're looking forward to a wonderful interactive session with great enriched learning for your health and fitness. Thank you.
Thank you, Vishakha ma'am. Next up, I invite our head of department, Ms. Vibha Hasija, for setting the context of the seminar and share more about the department.
Thank you, Zikra. A very warm good afternoon to each one of you, our students of Nirmala Niketan, as well as we have some guests here. And online joined with us is a very large number. And welcome to each one of you who are watching us live. And this is the representation we have is from all parts of the country, very renowned academicians and dietitians who are there. So warm welcome to each one of you. It is our great pleasure for the Department of Foods, Nutrition and Dietetics of the College of Home Science, Niketan, a 52-year-old department, to host this conference. And it is really great to have this wonderful collaboration with the PCOS Society of India. Thank you, Dr. Durusha, for being here with us. You have come here many, many years back when I was a very young teacher, and now you are back again, and we look at many, many collaborations in future, because the reason why we do things and we are creative about organizing events is because we want to take it ahead, and there's a lot more that we can accomplish when we all come together. I thank Dr. Vishaka, Ms. Noella for always supporting us. Ms. Sabina, a member of management, is also here. Warm welcome to you, ma'am. Your place is with us on the days here, but I know you prefer to support us from there, from all parts. And I want to especially call for a round of applause for Dr. Yasmina Avari, who has conceived this session. Thank you, ma'am. She has worked very hard for this, and she has the she had the touch point with Dr. Durusha, and we are really blessed to have Dr. Durusha and her very wonderful team here, because the way forward for wellness and health is multidisciplinary, it's interdisciplinary, it is alternative, and it's holistic, all coming together. And that is one very important message we take away from here, that when we want to create a change, now we may be at the Department of Foods, Nutrition and Dietetics, and we may be nutritionists here, but when we come together as health professionals, that is when the change really happens. And the program that is coined today through Dr. Avari and Dr. Durusha is especially that it's multidisciplinary, it's interdisciplinary, and it takes into account that we as human beings are multifaceted, and we are not just physical bodies here, and the physical body is not the only thing that we have to take care of. There are so many other aspects that all have to integrate well together. So it's really sad that something which is so natural for life, that is a good reproductive cycle, which is inherent to humanity and its evolution and its survival, it's so sad that there are issues in this in our population, our very young population, the girls, young adults, and older women right across. We are seeing the issue of PCOS and reproductive disorders increase in very large numbers, and here is where, as nutritionists, we come together to bring back to health. Dr. Shah, I'm sure you agree with me that we need to get a U-turn back, and we have to come back to health. We cannot have our young populations in the throes of metabolic issues, which is really causing upheaval in their lives of not having a ability to create a family life and bring forth life ahead in the best way. So here is where we are discussing PCOS, and the best part is all of you will be rewarded with an academic feast, because we have the best speakers over here who will talk about the multidisciplinary aspect and how we can create a change. So for the students of nutrition, so we are having, whether we are young graduate students or whether we are postgraduate students in dietetics or MSc in dietetics or MSc in sports nutrition or MSc in food processing preservation, any of the allied fields, this reproductive health is a very important issue, and it is time we all come together and find ways of how we can contribute to making a change in this aspect of life. So let us, absolutely rightly titled Unlipping PCOS, let's talk about it. Let's talk about it more, and let's talk about it every day, and let's talk about it with everyone, so that the awareness is there that there's an issue like this and we have to create a change. So let's unlip PCOS. Thank you for a patient hearing.
Thank you so much, Vibha ma'am, for your dynamic words. Now let's hear more about PCOS, wellness and health. I would hence invite Ms. Fatima Kadir to please throw light upon the same.
Good afternoon to all the dignitaries on the dais and my dear students and teacher colleagues and also those who have logged in online, a very good afternoon. I am the convener of the Wellness, Fitness and Holistic Health. I want to say this again because we have just kind of changed the nomenclature of a formally known committee, that is Diet Counseling Cell. And the reason we changed the name was to expand and to include other determinants of health, which is the social, economic and psychological determinants. And like Ms. Vibha has already said that, you know, you cannot have a just one discipline approach to solving a multidimensional disease, which is PCOS. And when I talk about multidimension, I also mean the dimensions of social, economic, gender, and all the other factors which we mostly in the field of medical and nutrition tend to forget. So I would like to reinforce that. Besides that, just to get it, you know, more into perspective, the NFHS 5, 2019-20, extending towards 2021, has put the TFR, which is the total fertility rate, going down from 2.2 to 2, and we are looking at a replacement rate of 2.1. So we are much below that. And the TFR is not just about replacing the population, though that's a concern, but it is also about, you know, the reproductive health. And as nutritionists, we all know, and I would like everyone to know, that your reproductive health is not only to do with the ability to reproduce, but also the role of estrogen, a very important female sex hormone, in your maintenance of blood pressure, when it comes to bone health, and there are so many other things. So reproductive health like that is important to every woman, okay? And I don't think so it only remains restricted to women. I think women is a part of the society affecting all domains of our living, so it is equally important to men as well. So with that, I want you to, you know, sit back, listen to the expert, and also feel free to share certain things that I think we are very fortunate to have such an, you know, great expert here. And I think we should take this opportunity to have a very good discussion and discourse on this topic. Yeah, thank you, everyone.
Thank you, Fatima ma'am. I would now like to invite Professor Dr. Kamini Rege to share more about women's empowerment through health education.
Thank you and good afternoon to one and all here. I'm sure all of you are eagerly waiting to listen to the experts. And I'm sure that's what you are waiting here for. I would only say Women's Development Cell definitely is looking for holistic development of each woman, whether within college or outside. I too am waiting to listen to the experts, so I'm not going to take much of your time. Thank you very much. All the best. Please do clear out all your myths and get the facts right. Thank you so much.
Thank you, Kamini ma'am. I would now like to request Dr. Awari to please take this seminar ahead.
Good afternoon to one and all. I have been given the honor and the privilege of introducing Dr. Duru Shah. Honestly, I don't know where to begin and where to end, because our association, I can say very easily, ma'am, is like a lifetime. I've been given this one little slide, and I think it is injustice to introduce her using only this one little slide. But as Kamini ma'am said, let the experts talk, so I'll adhere to this. Dr. Duru Shah, Founder President PCOS Society India, Director Gynae World, Center for Women's Health and Fertility, Panel Gynecologist, Breach Candy, Just Look Hospitals, Board on 3 international organizations on reproduction, author of 200 publications, chapters in national, international journals, books, past president of 4 national organizations on women's health, first and only Indian to receive FIGO's Distinguished Merit Award, Mahatma Gandhi Award 2021 for Social Responsibilities and Gender Equality, Lifetime Achievement Award for lifelong commitment to our specialty of FOSG, ISAR Lifetime Achievement Award for Excellence in the Field of Infertility, MOGS, Dr. Purandare Outstanding Service Award for Lifelong Commitment, Midday Powerful Woman 2022 Iconic Gynecologist and Fertility Expert by the Governor of Maharashtra at Raj Bhavan, Mumbai. I think it should be a resounding applause. Hope you all had lunch and we couldn't do a little better. So I think now what we will do is listen to our expert. Do we have anything else, Vikram? Yeah. So now, small token of appreciation for ma'am. I'll invite ma'am and Vibha ma'am. Please come forward, ma'am. Vishaka ma'am.
One more thing.
Instead of flowers, we like to do plants or make flourish. Thank you. Small, healthy token. Yeah, girls. Yeah. Let's start. So we now invite Dr. Shah to just enchant us with her lovely talk. Thank you so much.
Thank you, Yasmin. You want a hand mic or you don't want to? I prefer a hand mic because they're saying my face won't show. Okay. Like this is okay? Or it's coming in the way?
No, you.
Flat. Okay. Okay.
That's fine?
Yeah, you can see it on the screen.
It's too far.
Okay.
I can't see.
This is okay?
I can't see. That is the thing. This is better. Good afternoon, ladies and gentlemen. Can you all hear me? Hello? It's echoing. This one, can you hear this? Or you can hear this? Can we switch off these lights? These lights, can we switch off? Even these. Switch off these lights. Good afternoon, ladies and gentlemen. First of all, let me thank the team at Nirmala Niketan for having this program for us. And we are very, very keen to talk to you all about PCOS. It's something which every woman and every man needs to know. And I will explain why. Because this PCOS stands for polycystic ovarian syndrome. And we know that almost 1 out of every 4 women suffers from this problem. It can occur at any age, and I'll explain to you what really is happening. So, how do we know that you have PCOS? Now, it's a very, very simple way of diagnosing. We have put up an assessment form for you. In that assessment form, we have put up few questions. And if your more than 4 questions come positive, saying yes, yes, yes is an answer, it means you're likely to be having PCOS. So it's so simple as that. And if any 2 out of 3 criteria are present, we call it PCOS. So if your periods are less than 21 days or more than 35 days, or you have less than 8 periods in a year, or you have no periods till the age of 15 years. You come into the suspicious group, not yet confirmed. Then we have a situation wherein you may have ovaries which look on ultrasound polycystic, means there are many eggs inside, and that is another thing if it is positive, again suspicious. And the third is if you have symptoms of extra male hormone in your body, which could mean that you may have a lot of acne which just don't settle down, you have hair growing on your face, you lose hair from your scalp, etc. So if any 2 out of these 3 conditions are met, then we would label you as having probably PCOS, and we would like to confirm the diagnosis. Then it affects a woman mainly. I think when a young woman has hair on her face or acne consistently, it affects her mental health. It causes a lot of embarrassment, it causes a lot of depression. These are issues which have already been identified and also has been diagnosed. Then there could be problems as a young girl grows. She may could put on a lot of weight. That's again a cosmetic issue. And she may, because of her irregular periods, may have no control on her periods, and she may bleed heavily, or she may have fertility issues later in life. When she gets pregnant, there could be an issue of her developing diabetes, because PCOS is considered as a high-risk factor for developing diabetes in future. So a large percentage of women who have got PCOS, if they don't take care in their younger days, there is a high risk of developing diabetes during pregnancy and even as they age further beyond the age of 40. So PCOS doesn't settle down as you get older. It's just that on the ultrasound, the ovaries start getting, the eggs start getting lesser and lesser, the cysts start getting lesser and lesser in the ovaries, but the volume also starts reducing. And finally, there's a very high chance of developing high cholesterol, high blood pressure, and also diabetes. And later on, it could also lead to a cancer of the uterus. So it's a system which is which is a condition which is present right from the younger days, going up to menopause, and then beyond menopause also. We don't know what really causes PCOS, but as I mentioned to you, the various hormones in the body get affected. The female hormone may be high, the male hormone may be high, the female hormone may be low, the male hormone may be low. It's a different situation where there's an imbalance of hormones. That is what we would call it. Until today, we do not know why it occurs, but we know that we can manage it, we can diagnose it, and that's a very good thing, because 300 years ago, they talked about having ovaries which are looking like pigeons' eggs. But as the years went by, after, it was only in 1935 that it was first condition was brought in called polycystic ovarian disease. But it's not a disease, it's a syndrome. We don't know what causes it, so we have no cure. For a disease, you need to know what is the disease in terms of, say, if I say you have malaria, it's a mosquito bite which causes malaria. If you've got typhoid, it's something in the bowel, in the intestine, which is causing that typhoid. TB, we have an answer, but we don't have an answer for PCOS because we don't know what causes it. And we know that it causes these various symptoms, and we know that we can handle them. So that much we know. 80% of our women with PCOS are overweight or they are obese, whilst 20% can be even lean. If you think that you are lean and you can't be having PCOS, is not right. If you have any of those 2 other conditions which we talked about and you are lean, you could still be having PCOS. So this is what I've just discussed, 20% being lean. And obesity, of course, is not necessarily, it's a poor lifestyle for these young people who are overweight. Sometimes it's all the hormonal imbalance in the body which prevents them from losing weight. Normally, a woman comes to me and tells me, Doc, I'm working out every single day. I'm losing 400 to 500 calories through my exercise. I'm not eating sweets, I'm eating very healthy, and still I'm not able to lose my weight. So it's something which is so frustrating for that young lady, so that, we know that it's a hormonal imbalance, and we empathize with her. And we say, no, it's not that it's your nutrition which is It's not that you're being unhealthy, you're being healthy, but it's your body which is causing it. But of course, there are a lot of young people who are unhealthy, who are just sitting, not exercising, they're sedentary, they're on TV, they're on their WhatsApp, they're on social media. Whilst they are doing that, they are eating chips and they are eating all kinds of wrong food. So this is where the sedentary lifestyle and wrong diet can cause a problem. So that causes the problem much more. Eating junk foods, as we call junk foods, we call French fries junk food. This plate of hamburger, the combination of fries and hamburger and the Coke, all together will give you about 750 calories in one shot. So that's something you can't afford. It's something we have to stop right from childhood. We have to stop kids eating wrong food right from day one. So this is exactly how the PCOS woman looks. The obesity is more at the waist. If you see on the left-hand side of the diagram, it looks like an apple-shaped. Whilst a woman who's putting on weight, she's got a pear-shaped body. Her waist is fine, but the hips widen up. That's more genetic, where she puts on weight. But when a woman puts on weight on her waist, that is the problem. That suggests that she's building fat into her abdomen, which is the cause of her insulin resistance. I'll come to what is insulin resistance. So if you have here the BMI, as we call body mass index, that's a normal way we measure the obesity of a person. There is always a standardization. When it comes to international global population, we say that a normal BMI is up to 24.9 and above that is overweight. But the Asian population, we are Asians, we are in India and South Asia. And these are the measurements for us. There's a definition which is different for Indians compared to not only Indians, all people living in South Asia. What has been found is that at the same weight, women from India will have more fat in their abdomen as compared to an American woman who's the same weight as you. So in short, it means that we have got more insulin resistance within our body, and insulin resistance is a state like a pre-diabetic state. If you don't take care, you're going on to get diabetes in future. We also know that India has the largest amount of diabetics in the world, and that is why we need to be more particular and more careful about this. Then we come to what are the problems which can occur with PCOS. As I said, as you get older, you could get diabetes, high blood pressure, heart disease, cancer of the uterus, sleep apnea. Means you can't sleep in peace, you're snoring away. And at that time when you snore and you're breathing heavily, you don't have enough oxygen going into your system. And sometimes it can be very disastrous. So that needs therapy. Depression and anxiety is very high in people who have got obesity, plus who have got a lot of cosmetic issues, they have, and infertility issues. All these are, sort of beginning of anxiety and depression. So then there are eating disorders which come up because of depression and anxiety. So here we have a chart which talks about if a woman is, as she's getting older, if she's having irregular periods and she wants to plan a family, she's having trouble planning a family because she's not getting pregnant, she's tried. Then she comes to the doctor, and then when we see her, we examine her, we come to a conclusion that, she's got some hormonal imbalance. If she loses weight, then, or even if she loses 10% of her weight, it'll help her to get pregnant faster. So if she's overweight, we make her lose weight, we support our patients. We put them onto a nutritionist. We put them onto if she's got a depression, we send her to a mental health expert. And at the same time, we also ask her to exercise. So a fitness expert comes into the picture. See, we alone cannot manage the patient. We will guide the patient, but each specialty needs definite intervention. And therefore, all this comes with fitness, with eating healthy, and trying to lose weight. And of course, we would help her with medication. We would probably put her onto the endocrinologist if we find that her sugars are going high, if her thyroid is disturbed, if any of her hormones are disturbed. So this is where all the disciplines come in managing our patients. So here we know that by losing weight, she's likely to get pregnant faster. Her periods would come normally. But if she comes to us, as many women today come to us very late in life, many women are into careers, and they get married late or they plan a pregnancy late, And by the time they decide they want to get married and they either get married or not married, she wants to have a baby at say 36, 37. The ovaries are aging. By then the eggs in the ovaries are aging. Even though she may have a lot of eggs in her ovaries, but they are getting older. And therefore the chances of pregnancy also start reducing. And hence today we tell our patients, please freeze your eggs till you think of having a baby, because that will make your eggs, younger eggs remain, and a chance of fertility is higher. But more than that, we correct the hormones. So when I come to insulin resistance, what is really insulin resistance is explaining that when you eat food, you're having food which contains some amount of carbs or whatever food you're eating. So there's insulin, a signal goes to the pancreas gland and says, okay, there's sugar rising in the blood. Come on, buck up and get it utilized. So the pancreas releases insulin. For some reason that insulin does not work well for this patient. And therefore the pancreas goes on increasing more and more insulin secretion to combat that sugar which is rising in the blood. And that is how the insulin goes on increasing. This is called insulin resistance. And a day comes when that doesn't work. It's like a tired horse. Pancreas gives up and then you've got diabetes. So here we say that when insulin is rising high, that insulin works like a growth factor. The more insulin you have in your body, the more you put on weight. So this is where it comes to, we reduce the insulin levels, we make that work better. The insulin works better. We don't really reduce the insulin by giving a drug to reduce the insulin. We make the insulin work better. We use insulin sensitizers. So this is how we help the patient to lose weight. Of course, when it comes to infertility, we help them with medications. We help them by bringing on the egg release at the right time. We help them in different ways and help them to get pregnant. Quite a few percentage of our women get pregnant quickly because we have brought their periods, their ovulation, regularized, and they get pregnant. We have corrected their hormones. And this is something which I want to bring out. I want to use this forum to tell all women here that those who are planning a pregnancy in future, not today, whenever, please make sure that you've seen the doctor before getting pregnant. Make sure you don't have a pre-diabetic state. Make sure that your hormones are all okay. Because whatever is there in your body, if you have an infection, if you have any genetic disorder, all this will get transmitted to the baby and then the baby will suffer. So at least 3 months before planning a pregnancy, preconception care is something we recommend not only to PCOS women, to all women who are planning a pregnancy. So the effects of PCOS are in a way, when a woman first of all has trouble getting pregnant, or if she gets pregnant, she may have a miscarriage, or if she doesn't have a miscarriage, she can develop gestational diabetes. That is, she develops diabetes during pregnancy, and that gives rise to very large babies. And these babies who are within her womb, if her hormones are not controlled and if her sugars are high, are likely to also develop diabetes when they grow up, those children. So again, if you want to protect your child, make sure everything is okay before you get pregnant. Conceiving is not a problem. It's easy. As I told you, we have discussed what we need to do. There are lots of treatments available for infertility. And if we are in an infertility clinic, or any gynecologist can help with the patient with fertility treatment. And if that simple treatment doesn't work, then she goes into assisted reproduction. Lifestyle changes I've mentioned to you all, and I've talked to you all about weight loss, and I've talked to you about a balanced diet. There is no magic diet. There are so many diets which come up. It's a simple formula. What you are taking in and what your output is the most important thing. And I'm sure during the panel discussion, our nutritionists will speak more about details about what you need to know. So I'm not going to go into that. Then we come to the people who manage the patient. As I told you, we have the gynecologist, we have the endocrinologist, we have the dietitian, we have the fitness expert, we have the mental health expert, and we have the dermatologist. Dermatologist means people who have a lot of hair on their face, who need constant laser, who need constant acne therapy, pigmentation. These are all the issues. But that can be corrected by correcting the hormones and by giving her the correct treatment and doing the cosmetic therapy which will take care. There are a lot of young girls who have got acne and hair on their face, and they keep going to a center to remove the hair, treat the acne. And now this was happening many years ago. But now after we have been talking to all the experts from the different departments, and now at least the dermatologist, if a girl is not settling down within a few months of her treatment, she'll tell the patient, the dermatologist will tell the patient, please go to your gynec and check whether you have PCOS. It's important, and that is why we work multidisciplinary, because everyone should know what really happens with PCOS. So this presentation has been brought to you by the entire team from the PCOS Society of India, and this is something which we believe in, and we say that this is a basic information you need to have. And I thank the entire team from the PCOS Society, all our volunteers who go and speak at various forums. We have been doing the Vijayata program all over the country for the last 2 years, and we have reached out to thousands and thousands of people, both physically, digitally. Even today I know that this program is being live streamed on YouTube, and it's something which we are reaching out to many, many women and many, many men also. So here we are, and I will close over here my talk. I have introduced the subject to you all, and I'll request the panel to come in and have a little discussion, which will be the practical aspects of how to handle, and what I will want from all of you to put in your questions, whatever questions you all have, and the panel will answer. The expert concerned will answer all your questions, and Dr. Sarita Bhalerao will be moderating the discussion, and we'll have the experts up here. So again, thank you very much for your invitation, and I'm happy to be here and be a part of this program. Thank you. I will request Dr. Sarita Bhalerao, who is a gynecologist, part of the managing committee. May I request you all to please introduce Dr. Bhalerao, and Dr. Bhalerao will introduce the rest of the team.
Thank you, Madam. I'm Dr. Sarita Bhalerao, and it gives me great pleasure to moderate this panel. At the outset, let me thank Dr. Durusha for giving me this opportunity, and thank the staff of Nirmala Niketan for having us here. You want to
say a few words? Sorry.
Go ahead.
Just a minute.
Go ahead. Of course.
We'll just set this. Pre-event.
I would like to once again thank Dr. Durusha for her wonderful sharing with all of us. I'm sure we've already learned a lot. I would thus like to conclude this segment and leave you with this one beautiful thought. Embrace your strength through this journey of your life, with or without PCOS. For every challenge you come across is nothing but an opportunity to nurture your body and reclaim your power. Thank you, and I now hand over the mic to our next moderator for the upcoming group panel discussion. Thank you.
Yeah. May I welcome all our... You want to say something? Okay. Sorry.
Okay. So I would also like to thank Dr. Kavita Bhatia for giving us the health products that she's got. She's also the founder of Power Plant. So let's start with the panel discussion. So for our moderator today is Dr. Sarita Bhalerao. She is an obstetrician and a gynecologist at Bridge Candy Hospital, Reliance HNH, Safi Hospital, Bhatia Hospital, Vadia Hospital, Maternity Hospital, Mumbai. She's also a president of Mumbai Obstetric and Gynecologist Society from 2021 to 2022. She's also a committee member of PCOS Society of India. And our next I would also like to call upon Dr. Durusha to join in as a panelist.
Are you calling all the panelists or should I call them? Oh, one person is, okay. No, each person is calling one person. So I think, madam, you and I will sit down. We will sit. Come, madam, you are in the center.
So our next panelist is Miss Neeti Desai. She is a consultant nutritionist and diabetes educator. Her clinic is in South Mumbai. She was attached to Kumbala Hill Hospital for 17 years. She also serves as an honorary secretary at Association of Diabetes Educators. She is also a co-editor of Indian Dietetics Association latest clinical dietetic manual and has authored chapters for various textbooks. She also has a regular column in Health and Nutrition for 18 years. And she is also an official nutritionist Femina Miss India 2008. So we welcome you, ma'am.
Our next panelist is none other than Dr. Altamash Sheikh. Dr. Altamash Sheikh completed his MBBS as a state ranker from Rajiv Gandhi University of Health and Sciences. He earned a Diplomate of National Board in General Medicine from Mumbai Port Trust Hospital in 2007. He further completed a Diplomate of National Board in Endocrinology from PD Hinduja Hospital and Medical Research Center, Mumbai in 2011. Dr. Sheikh gained extensive experience through internships and residencies at prominent hospitals across India, including Civil Hospital at Bijapur, Bombay Hospital, Mumbai, Chem Hospital at Mumbai, PGI at Chandigarh, and many more. He is actively involved in national and international workshops, training programs, and conferences. He plays a significant role in teaching undergraduates, postgraduates, family physicians, and paramedical staff. Dr. Sheikh frequently organizes diabetes education program and is instrumental in establishing diabetic clinics. He has co-authored research articles and is a reviewer for peer-reviewed journals, regularly presenting at national and international scientific conferences. We welcome you, dear sir.
So our next panelist is a dynamic personality, Dr. Aishwarya Chavali. She is a sports and exercise medicine physician. She is currently working at Sir H.N. Reliance Hospital as a sports medicine physician. Previously, she worked as an orthopedic house officer at the Balasaheb Thackeray Trauma Care Hospital, Mumbai. She has completed her master's in sports and exercise medicine from Queen Mary University of London, United Kingdom in 2023. She has completed her bachelor's in MBBS from SSR Medical College. She has authored research papers for Queen Mary University of London. She has participated in various important events conducted by the Tamil Nadu Physical Education and Sports University, and also a conference conducted at Sir H.N. Reliance Foundation by Cleveland. She is driven by a profound passion for enhancing athletic performance and facilitating injury rehabilitation in the dynamic realms of cricket and football. We welcome you, ma'am, to this prestigious institute. Thank you.
I am delighted to introduce our next esteemed panelist for today's session, Dr. Sapna Bangal. Dr. Sapna is an exceptional figure in the field of psychiatry and has extensive qualification and experience. She holds a MD in psychology, diploma in psychological medicine, medical research council in psychology from UK, and has successfully completed the certificate of certification of training from UK. She has specialization in young people and also a family psychiatrist. She has also received a membership of the Royal College of Psychiatrists in 2009. She has also acquired both undergraduate and postgraduate psychiatric degrees from the renowned Nair Hospital in Mumbai. She is specialized in child and adolescent psychiatry in the UK. She has experience over 20 years with psychiatry with young people. Her areas of interest are vast and cover critical subjects like eating disorders and emotional problems in young people. Her approach to psychiatry is deeply holistic, focusing on multidisciplinary care that emphasizes individual care, strengths and weaknesses, which is an approach that reflects her profound understanding of the complex needs of her patients. Moreover, Dr. Sapna has a keen research interest and has contributed to various journals with numerous research papers, particularly focusing on self-harm and suicide in young people. Her vision is powerful and clear. She aims to reduce the stigma around mental health in India and to implement evidence-based psychiatric care throughout the country. We are honored to have Dr. Sapna with us today, and I am sure we will all benefit immensely with her insights and expertise. We welcome you all, ma'am.
We now have Dr. Sunita, MBBS dermatologist, has nearly 20 years of experience in dermatology and cosmetology. She is a consultant dermatologist at Skipnosis Dermatology Clinic in Mumbai. She is currently practicing in Mumbai since 2016, and she started her career in 2005 at Kaya Skin Clinic in Punjab. Dr. Sunita's expertise is in clinical and aesthetic dermatology, with a focus on teen wellness. Her clinic is equipped with advanced laser technology for treating acne, scars, pigmentation, hair reduction, and skin rejuvenation. We welcome you, ma'am. Kindly join our panelists.
I now request our panelists to please begin your wonderful session.
Thank you very much, and with that we'll begin the panel discussion. So what we thought we will do is that first we will ask, I will ask our panelists certain questions and they will give us their answers, after which we would really like to make this an interactive session. So if you could please note down your questions, put it on a piece of paper. You're most welcome to stand up, introduce yourself and ask the question, but if you wish to write it on a piece of paper and send it to me, I can also take the question up with all the panelists. So I'm going to start, and I'm going to start with Dr. Altamash, who's our endocrinologist, and my question to him is PCOS on the rise? What do you think? Oh, you have a mic.
Thank you so much, ma'am. Good afternoon, everybody. I think that's a very important question. It's like saying, are we really progressing as a race, as a human race, as Homo sapiens? One of the lady on the dais some time back said, women are a part of society. I say, no, women are the society, men are a part of this women's society. Number one, thank you. Number two, PCOS, as Dr. Durusha ma'am said, it is polycystic ovarian disease. Any human being who's got ovaries inside her abdomen will have PCOS. Two, is it on the rise? Absolutely, it is on the rise for a lot of factors, for a variety of reasons, and not from 5% or 10%, we are seeing up to 20-25%. Not just the issue of dermatologist or gynecologist or nutrition or mental health, but overall, including infertility specialist, and a lot of it is because of, as you saw in the slides, 80% with obesity and insulin resistance. Alarmingly high, and we need to tackle this as soon as possible.
Thank you, Altamash. I'm now going to ask Madam Dr. Durusha. She has an international figure in this area. I'm going to ask you, Madam, how does India compare with the rest of the world?
I think the prevalence from different parts of the country is different, and it depends a lot on ethnicity. Indians, unfortunately, have some ethnic problems, something in their genes, which is probably causing this risk to be higher. So if you see not only India, if you see women from Pakistan, you see women from Bangladesh, all these regions have a higher prevalence of PCOS. So ethnicity plays a role, genetics to some extent plays a role. That is, genetically they have not yet been able to determine which gene is a problem, but they've got multiple genes they have found common in the PCOS women. But they say about 5 to 10% is genetic transmission. To some extent, ethnicity comes into the picture. And the more important thing is epigenetics. Epigenetics, as I was talking earlier, that it is the environment in which the baby is growing. If the mother is diabetic, if the mother has got obesity, she's got insulin resistance, she's got high androgens, and the baby is growing inside for 9 months, it's not the genes which change. The DNA doesn't change, but it gets mutated, it gets altered. And that is what causes PCOS to grow from mother to daughter, daughter to granddaughter, granddaughter to the great-granddaughter. And that is why I think it's extremely important that you get pregnant before you get pregnant, get everything corrected.
So, madam, girls whose mothers are PCOS, does it mean that they will always be PCOS, or can they in some way alter that?
They can alter it, as I said, if the PCOS mother has been seeing the doctor before getting pregnant, and the doctor realizes that she's got these problems, the doctor or the gynecologist will get everything corrected and then allow her to get pregnant. When she does that, the transmission will be almost not there. As I mentioned, genetically it's only about 5 to 10%, but this epigenetic problem will go away.
So there's a big role of the environmental factors is what madam is saying, and even a young girl who looks after her diet, looks after her exercise, can prevent herself from becoming PCOS. And that brings me to the next issue, and that is of diet. And I'm very happy to welcome Dr. Niti Desai. She's an alumnus of this very organization. She says she's done her master's here. And I'm going to ask her, in India is a very big country. So many people have so many different diets. If you look at all of us, we all probably have different diets. So how can we all control our diet and make it more healthy? Can you give us a few tips?
Yeah, sure. On the outset, I would like to thank the PCOS Society for having me here, and Dr. Durusha ma'am for this very innovative Vijayata program. And of course, always glad to be back to my alma mater. I think this time it's been less than 2 weeks. Tips, yes, as Sarita ma'am said, basically we all eat differently, but there are some common issues. One is that we as Indians are a carb-loving nation. We just love our carbohydrates. So whether you go north or east, south or west, studies have shown that our carb intake is nearly 70%. Initially it was thought that it was only the South India who was eating more, but that's not the case. So the simplest and the most effective way, whether we are looking at weight loss, which is important for PCOS, whether we are looking at reduction of insulin resistance, we need to step up our protein intake. We need to reduce our carbohydrates and replace the refined carbohydrates, a lot of polished carbs that we eat with complex carbs, and most importantly, cut the carbs and replace some of it with protein. And this is important even for the non-vegetarians, because in the Indian scenario, even if you eat non-vegetarian once in a week, you call yourself non-vegetarian, but majority of your intake is vegetarian and a lot of carbs are there. So we all know we have to cut down on fat. We all know we don't eat fried, we don't eat sweets, but still, as madam was mentioning, a lot of women don't lose weight because they're doing the obvious, but still not. The problem is in checking out the carb intake. I think that would be the biggest takeaway.
Yeah. What about eating patterns? Because, I know students they leave without having breakfast, then maybe they'll have lunch, or maybe they'll order a vada in the evening. Tell me how many of you are doing what I am saying? Am I not right? Yes? And sometimes they'll have dinner late, sometimes they'll be watching TV. So what about eating habits and eating patterns? Can you throw some light on that?
Yes, so what you eat matters, but when you eat also matters. So breakfast is very important. There is this intermittent fasting phenomenon going on, and especially young kids. This crowd sleeps late, wakes up late, skips breakfast, and then says, I am doing IF. So this IF doesn't work. Intermittent fasting, even if it is, you have to start early and finish early. nighttime binging, nighttime eating is worst when it comes to weight gain and insulin resistance. And we are basically living in an obesogenic environment now. Even at 10:30 p.m., somebody wants to have a dessert. One swipes the order on the mobile, and in 12 seconds, 12 minutes, the dessert is there. So we really need to combat this. The environment is also very inviting. We need to be very sure of, so very often we tell our patients just delete the app, okay? And the blue screen, also the sleeping time also matters a lot. I tell, my standard line is human beings are supposed to sleep PM and wake up AM. You're not supposed to sleep AM and wake up AM. So that is also something we need to look at.
Yeah, of course, Altamash. Go ahead.
Yeah, I think what she talked about, the eating pattern, that was a question. So I think a little more inside. The basic or the main component of PCOS is insulin resistance as of now today that we know. More of insulin, it will act on the ovaries, cause more of androgen, that's the male hormone which may go high. Now this in the eating center can cause alteration of the liking of the food. It's not that the girl is eating purposely on the wrong food. It is also the liking of the brain, the reward of the brain which is going towards the food which we call as the drunk. So that needs to be come down. Second thing, I think it's a matter of if and buts. Two things. Ma'am said that a lot of women are career oriented, and we, as in one of the articles I read, India is a nation which sits on the butts or works on the butts. Yeah. Most of the times we are sitting but. And here we need to come out of that if you're doing the IF, intermittent fasting, if in a wrong way, without the help of the right nutritionist, without the help of the right professional expert, if they will become oof. So I think that's where you need to take the total amount of any diet that you are going to follow. First, it should be professional. Two, it should be with a medical protocol. And three, it should cause you calorie restriction or a calorie deficit. If your diet is not causing a calorie deficit, you would not lose weight. And remember, diet is a part in lifestyle modification and losing weight. So what she described, the garden variety patient, yes, people do have a lot of disturbances in losing weight, but they have to see all the 8 prongs of losing weight so that everything is taken care in that angle.
Thank you, Altamash. And now let's go ahead. We know that exercise is a very important part of this whole lifestyle. And I'm going to ask Dr. Aishwarya, our exercise expert, why is exercise so important and what kind of exercise do you recommend?
Well, thank you for firstly having me here. And then I believe in today's world, exercise plays a very important role, just not with PCOS, but even with respect to other diseases and modalities as doctors that we are trying to treat. With respect to PCOS, the major problem, which is insulin resistance, is a tackling thing. So as a fitness expert and as a sports medicine physician, we do recommend exercise as one of the priority goals is because we're trying to deal with the insulin resistance in the first place. That is also considering that when we come across women who are dealing with PCOS, we have to acknowledge the fact that a big ratio of them have never worked out in their entire life. So when we do recommend exercises of fitness to them is to first get them into the groove of making them understand is that it's not an overnight miracle that's going to help you to get rid of PCOS. The point of fitness here is that we are gradually trying to make the body acclimatize to making the problem of insulin resistance to insulin sensitivity. That is, which will help you to regulate the hormones in the body which are already dysregulated or basically the LH to the FSH ratio is disturbed. And another question is that how much is too much of exercise? So as I mentioned earlier, if you give an exercise program to someone who's never worked out and say, let's go for a HIIT intensity workout, I believe they'll come back with an injury next day. Okay, and they will say, I am not going to do this ever in the rest of my life. I will just prefer doing a good rigorous diet. But I don't think they're going to see the results overnight. So when you do prescribe exercise, you need to be very gentle. That is, we recommend a moderate intensity exercise, which is between 50 to 70% of your heart rate capacity, and subject them to more of aerobic exercises and then shift them towards more of high intensity exercises through the week. So yeah.
Dr. Aishwarya, do you think that fat, overweight as well as underweight, everybody needs to exercise, or is it only for the overweight people?
That's a good question and a very debatable question that's been going on. I believe exercise is for both the sides.
For everyone, everyone.
Yeah.
Do we all agree that? Yes,
Absolutely.
exercise is for everyone. It is whether you are overweight, you are underweight, your weight is normal, everybody needs to exercise.
That's completely right, because we are trying to tackle insulin resistance. We are not trying to tackle who's obese and who's thin. Because me dealing with athletes, most of them are within their BMI category, but they still do come up with PCOS problems. Well, that defines the fact that having a good exercise regimen and a healthy lifestyle is the treatment modality towards dealing with PCOS entirely.
Okay, I'm now going to come to Dr. Sapna, and I'm going to ask Dr. Sapna, what are the commonly seen mental health issues? That's one question. And do you think that exercise also promotes mental health?
I'll answer the second question first. Absolutely. I think in all our patients that we see, we do advocate healthy eating and exercise, because it releases endorphins and serotonin, which are normal, natural antidepressants in your body. So that is absolutely essential, that irrespective of the conditions that you come to us with, exercise, sleep, and healthy eating is part of the, what we advocate people with. And then coming to the common conditions, I see a lot of young people with PCOS coming with anxiety, depression. I think at least there are studies showing that there are 50 to 60% prevalence of anxiety and depression in cases of PCOS. Along with that, we see eating disorders and disordered eating. So we see binge eating, we see emotional overeating, and that is a vicious cycle. So obesity leads to overeating, overeating leads to obesity. So those, and we come to sleep disturbances, we come to self-image issues, because it attacks mainly our, our core of believing what is feminism. That is why all these symptoms are very, very common in people with PCOS.
Thank you, Dr. Sapna. And my experience is whenever in the clinic I tell a patient, you need to exercise, first thing they'll say, but mere ko time nahi hai. So I say, okay, let's sit down. You have 8 hours of sleep, you go for work for 8 hours. What about the rest of the 8 hours? So the reason is not that they don't have time. The reason is that they don't have the inclination, and also they are not enjoying the exercise. And this reminds me that when Dr. Durusha and myself, we did a little video film in which we asked our own doctors, practicing doctors, to give their fitness mantra. And we actually had people giving, senior people giving walking, some giving gym, some giving Zumba, some giving racket sports, some giving hiking, some giving. So there are so many options now. And the important thing is that if you enjoy it, you will find the time for it. If you don't enjoy it and you push it into a 5 a.m. slot or a 10 p.m. slot, it's not going to happen. So rework your time schedule so that give it priority. I think that's very important. So now let's go ahead and let me ask Dr. Sunita. I think the commonest problems in practice are dealing with acne and dealing with excess facial hair. Could you throw some light on how we can manage that?
First of all, thank you, Dr. Durusha and Dr. Sarita. It's a wonderful opportunity to be speaking with the target audience. All the young girls sitting here, they are just the right audience, and it's good to catch them young and educate them. As a dermatologist, we sometimes are the first person in contact with the patient who has underlying PCOS, but they present with the other clinical symptoms, like they will have facial hair, they will have acne, they may have the hair loss from the scalp, where they feel the thinning of the scalp, thinning of hair is happening on the crown. Or they may come with the thickness of the skin, darkening of the skin or the back of the neck, in the underarms or in the groin area. For these reasons, they will consult a dermatologist. And that is when we try to look and evaluate and examine them, and we find most likely the cause is PCOS. There can be combination on board. Before starting any laser treatment, you need to fix your lifestyle so that your excess weight is little under control. When all these things happen, then the laser works better. Otherwise, the laser treatment is quite pointless. You keep on doing the laser sessions, but the hair will keep growing back. Anyway, girls with PCOS need far more number of laser hair reduction sessions than the normal people do. So managing the hormones is the first thing. Managing the lifestyle is the it goes in parallel. Both these things have to be done before we treat you for your skin issues. Likewise, girls who present with the darkness of the skin on the neck or the underarms, they want a quick fix for that. Our answer to them always is that you need to first lose weight or fix your hormones. These things will automatically start clearing out because that is a sign of insulin resistance in the body.
Thank you, Sunita. And now I'm going to ask our audience what questions they have. Would anybody like to stand up and ask the questions? You're most welcome to do so. Or if there are some chits, then we can have those questions as well. So I think Dr. Altamash was going to give us 5 steps to easy management. So that sounds very simple and very attractive. So can you tell us what are the 5 steps? Only 5.
And that's such a difficult question, sounds suddenly. So the 5 things if you have to do really for the management of PCOS, 1 is look at your food, 2 is look at your water, so that's hydration, 3 is look at your walk, that's your activity or exercise, 4 is look at your sleep or your rest that you're doing, and 5th is the gratitude or the thankfulness that you should be doing. So in 5 words, if I have to say, this is khana, pina, chalna, sona and shukrana. These are the most 5 important pearls. Khana, pina, chalna, sona, shukrana. Food, water, walk, sleep, and gratitude. These are the main 5 prongs that we take it from here in today's panel and we apply to ourselves. As said, it is not a quick fix. As said, that exercises for everybody start from somewhere and it is never the last resort. Everything starts from the day you decide that a woman is going to get treated.
Thank you, Dr. Altamash, and those are really very encouraging words, and I'm sure that we can all implement that and start with your 5 steps. So do we have any questions come online? Can you tell me if there are any questions? Okay. So till then, let me ask Dr. Sapna the next question, and that is that should all patients who have this PCOS be screened for mental health issues? Do you think we should do that?
I think definitely for at least anxiety and depression. I think the new guidelines also mentions that everyone should be screened because we are seeing so many, so much of mental health comorbidity with PCOS. And I think me and Dr. Durusha have been trying to get patients to come to see a mental health expert, and because of the stigma associated, it is so difficult to get them to see a psychiatrist or a psychologist. But if there is a screening questionnaire, which is just like, 5-10 questions as part of the assessment, which every gynecologist can do, which shows a high score of, say, anxiety or depression, then it can be treated rather than getting severe enough and then having to be treated with medication.
Thank you, Sapna, and we have some questions coming in. So I'm going to ask Madam Durusha the first question, and this is from Aisha Sayyed. Is metformin required for long-term by a PCOD patient who wants to conceive?
Metformin is a very great adjuvant to help with insulin resistance. So women who have insulin resistance, they do very well with metformin. And that's something which I think we give it to women when they are planning a pregnancy also. If this is only provided they are obese or they are insulin resistant, then they need it. Otherwise, they don't need the metformin.
Okay, thank you, madam. My next question is to Dr. Altamash, and his question is very simple question. What is the difference between PCOS and PCOD?
Most important question, I would say this is $1 million question. Similarly, as in the start, we saw some lady was trying to talk Durisha or Durusha, and then somebody introduced me as endo. I think that's where the catch is. We got to be very clear in our understanding that what we are dealing with is a PCOS, polycystic ovarian syndrome, which is an amalgamation of minimum 2 out of the 3 criteria that was projected on the slide when ma'am took that lecture. However, most of the times you will see that a girl, a lady, a mother or a sister has gone for a sonography and suddenly there is a written report saying that PCO morphology. Now, if the problem is only at the level of ovary and if the problem is only within the ovary seen as a sonographic evidence without having the other things of mental health issue, without having dermatological issue, without having gynec issue, without having any other issue of insulin resistance, in these cases, a local disease that is called as PCOD, polycystic ovarian disease. That's the local part. And when the full spectrum happens with rise in insulin, with rise in testosterone, with rise in other androgens, and you have excluded thyroid, you've excluded prolactin, you've excluded cortisol, you've excluded other secondary causes of PCOS, that then comes out as your primary PCOS. So it's a spectrum, and that's where you need to be careful about what you're talking.
Yeah, thank you, Altamash. And I think to put it very simply, this is a condition in which some women will have one symptom, some may have different symptoms, some may have no symptoms, and it will only be seen in the ultrasound. So it is what we call a heterogeneous presentation, and that is why there is a lot of thing in the definition. So I'm going to ask Neeti now, what is the role of vitamin D and D deficiency in women with PCOS?
Yes, I think it's a very good question. So vitamin D, as most of you would have studied, and is generally known as the bone vitamin. But now vitamin D has a role to play. It has multifactorial role to play. And in fact, vitamin D seems to have a very positive effect on insulin resistance. There have been enough studies which have shown that if somebody is deficient and if you supplement vitamin D to get the optimum levels, there is a difference. The insulin sensitivity increases and the resistance goes down. So we need, in practical terms, we need to make sure that we also look at the vitamin D status, check it in the blood reports, and optimize it if it is not.
Yeah. So I think the vitamin D also, it comes from sunlight, and we need in our lifestyle now we are not getting out in the sun. You need to have 20 minutes of sunlight from morning 10 to 4 in the evening, and you have to be exposed areas of the skin. So most of us will be vitamin D deficient, and therefore vitamin D supplementation is required in the form of either a sachet or a form of liquid or in the form of tablets. So let's go ahead now to the next question, and I think this is a question which is quite a long question, but I've got the gist of it. And this is somebody who says they don't get their periods on time. Sometimes they get normal periods, sometimes it takes 40 to 50 days and things. But I think that basically they need to be checked by the doctor. Yes, madam, I think that, would you like to say something?
Yeah, there are many reasons why a girl or a woman may have irregular periods. So therefore, it doesn't mean just because you have irregular periods, you have PCOS. It's not that. It's one of the symptoms of PCOS. As Dr. Altamash said, there are 3 factors we have to look at. If you have all 3, means you have irregular periods, you have dermatological issues, cosmetic issues, and you have ovaries looking polycystic on ultrasound. If all 3 are present, we call it the classic type. Then there are some who have got only the male hormone appearance, means the acne and the facial hair, and only ultrasound showing polycystic ovaries, but regular periods. Then there are some who have got, so the combinations are different. But you should have at least 2 of the symptoms out of 3 before you can call it PCOS. So this is what comes to, and if a patient has got irregular periods, to come to the answer, it's important to even check a thyroid. It may be only her thyroid which is not functioning well. It may be another hormone called prolactin which comes from the brain, which may be a problem. It may be cyst in the ovary, a simple tumor in the ovary. It could be anything. So she needs to get evaluated by the doctor, needs to undergo maybe some hormone assays and ultrasound before you can conclude that she's got PCOS.
Thank you, Madam. And our next question is back to Neeti, and this is regarding dairy products. Do we need to stop dairy products?
That's a controversial one. So there is evidence now that perhaps dairy and especially whey protein is related to acne. So a lot of time dermatologists, if the girl presents with acne, they will say stop the dairy, and especially if they are taking whey supplements, for sure. On a broad term basis, for a vegetarian, just to stop dairy for different reasons or for just because it's fashionable, it needs to be discussed, because for a vegetarian there are not too many first class protein options. So besides soy, and Indians are not so very friendly with soy anyway, so then what leaves with us is pulses and dals. So that is something that we can discuss, but yes, there is a correlation between dairy, especially whey, and acne. Dr. Tagra would want to add to that.
Yeah. Yes, Sunita, you want to add something? Yes?
So clinically, we have seen some patients do respond on stopping dairy. They do get clearance of their acne. It helps them. But as Dr. Neeti said, yes, it's a very catch-22 situation. On one hand, we want them to have high-protein diet. So if we cut out the dairy for a vegetarian, then the alternate sources are soy. Now, India is also a hub of hypothyroidism in women. So soy doesn't go well with hypothyroidism either. So it becomes very catch-22 situation. We have to tread carefully here. We cannot completely go on eliminating dairy for everybody. But someone who is not responding to traditional methods, weight reduction, exercise, diet, everything, after that, maybe we can consider removing dairy from their diet.
Thank you, Sunita. Now there's a lot of interest about something called seed cycling. And there's many questions on that. So Neeti, would you like to throw some light on what is this?
Yes, so again, this is the current social media kind of sensation. The two types of seeds have to be had in the first 15 days of the cycle, and the other two have to be had in the second 15 days of the cycle. There is no evidence, clinical evidence, that this seed cycling works. Seeds work. You need to have seeds daily. So it's sunflower, pumpkin, flax, chia, watermelon. So seeds are a great source of everything, vitamins, minerals, lot of fiber, lot of antioxidants. For example, the lignans in flax seeds seem to be particularly useful for PCOS. So please have seeds, a mix of 2 teaspoons of seeds every day. You don't need to make it complicated by having 2 seeds first 15 days and the second 2 seeds. That's not required. Seeds are important.
And how do you have these seeds?
Yes, so again, important thing is to chew them well. Lot of the seeds, because the outer coat is hard, if you don't chew, they will just pass out. So again, we do spend time asking patients to do this. You need to chew them well. Very often there are issues, then we say you just grind them and then sprinkle it on your oatmeal, have it with your fruit. But the important thing is chew them or grind them. You can't just swallow them.
I think very quickly, can I summarize in 3 lines? First was about the milk and milk products. Till the lady or the girl has lactose intolerance, there should not be a strong reason to stop milk and milk products. 1. 2, milk or milk products, sweets needs to be avoided, of course, yes. And point 3, you can absolutely have boiled milk, which is a day prior, and remove that cream and have it. That, if that's not possible, then slim fat milk that is available. Second was, she talked about soy, ma'am said. So unless you are having soy which is raw or in a form which is only mixed in water, I think that may cause an issue. Otherwise, soy with obesity and thyroid should not be a problem. And third, just now, I think she also spoke about the seed. You need a balanced diet. Balance of the omega-3, 1, balance of the omega-6, avoid trans fats. If you are crossing your seeds too much, 3 things can happen. 1, a newer dyslipidemia. 2, you will put on weight because too much of calorie and too much of protein, and also the oils are going inside. And 3, your hepatic glycogen storage will go up and you may land up in an MASLD or a fatty liver. We are already dealing in simple words, fatty ovary, that's the PCOS, and we are creating another disease. So I think she also has a lot of patients who say that from one bottle you pick up 1 seed, from another bottle you pick up 2 seeds, from the third bottle you pick up 5 seeds. I think we need to be more out to the public, talk to your nutritionist that, do I really need that? Right? You need a balance of the food, whichever way you are doing. And remember, again, I say, calorie restriction is the key. Thank you.
So thank you for that, the Altamash, and we'll now go to the next question, and this is that, can PCOS be treated with alternative medicine? So now we don't have any alternative medicine expert here, but I think, Madam, would you like to say something, or should I? Yeah, so go ahead, go ahead. Okay, so I feel that, you know, that alternative medicine like homeopathy and other fields, I'm sure they have benefits. I'm not the right person to comment on it. And that you must ask your homeopathy or your other, the Ayurvedic physician, and they will be able to guide you better on these conditions. So let's go ahead now with the next part of the question, and that is, does PCOS require any operation or surgery?
No, PCOS does not require any operation or surgery. As a matter of fact, many years ago, when they found that women, they got the idea that women who have got, they were actually having beards those days, PCOS women. And those women who had beards, and when they were operated upon for some other reason, they found their ovaries looking big and pigeon-like, pigeon egg-like. So therefore, the two doctors who were working on it, they called it Stein-Leventhal syndrome. Means the name of the two doctors was Stein and Leventhal. For many years, we used to, when we studied, we also called it Stein-Leventhal syndrome. Now the question is, what really happens in that ovary is producing a lot of male hormone. So what they started doing is chopping off a piece of the ovary, and they found when they chopped off the piece of the ovary, the woman started getting regular periods, and then she got pregnant also. So in short, a concept came up that if we need to get the hormones corrected, we need to take out part of the ovary or reduce the volume of the ovary, because the ovaries are large. So what happened is, when we started with doing laparoscopy, laparoscopic ovarian drilling started, wherein we made holes into the ovaries through a laparoscope, reduced the size of the ovary, and then we managed to get the patients getting corrected and started to getting regular periods and probably conceiving. But then there were some surgeons who were so over enthusiastic. They created the ovary looking like a golf ball. Dot, 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 as though the ovaries got smallpox. So in short, or chicken pox. So in short, what happened is the ovary got completely destroyed, and the patient started becoming menopausal prematurely, because the ovarian tissue was getting destroyed. So that thing has now completely gone off the radar. We don't do that any longer. We actually, if a patient is not getting corrected with medication, when she wants to get pregnant, we give them oral medication if it helps. We give insulin sensitizers like metformin. We make them lose weight. If they don't respond to all this, then we start giving injections. We start stimulating the ovaries to start functioning. And of course, if they just don't respond, we end up with doing IVF for them, where we collect the eggs from inside the ovaries, fertilize them with the sperms outside the body, put the embryo inside the uterus, and that is how they conceive. The biggest challenge of a big ovary or a large ovary, which is very thick capsule, is that the egg is not able to come out. It's got a lot of male hormone. The egg is not responding to the hormones in the body. So that's the only one indication where we have seen that the patient requires surgery because of PCOS. Recently, I did one lady whose hair growth is just not stopping. She's got so much acne, so much hair growth. She's got a family history of breast cancer. Mother has breast cancer, father's family, everyone has breast cancer. So we obviously can't give her any hormones to help her, like oral contraceptive pills. They work beautifully. But because they give you regular periods and also reduce the male hormone. But we can't give it to her. So how do we reduce a male hormone? That's the one woman I've done in the last, I don't know how many years, where I've actually drilled her ovaries. She's It's been 1.5 years and she's doing very well. And then sooner or later, I know those hormones will again start going up. Probably she may require another sitting, I don't know, we'll see how it goes. But that concept of drilling the ovaries has now completely been put aside.
Right, right. So I think
Hello,
in select
ma'am.
cases only.
Excuse me, ma'am.
Yes.
I have a question.
Yes.
My name is Sujata, studying for MSc Part 2, Sports Nutrition. So my question is, in order to lose weight, women start eating more amount of fruits instead of breakfast. There's one more question that doctors or dermatologists, they ask their patients not to have dairy as well as non-vegetarian food, plus no supplements also. So it makes us difficult to meet the protein requirement. Plus some people follow Dikshit diet, like having just 2 meals a day without taking care of the protein. So just throw some light, ma'am.
You want to take Niti?
Shall I say?
Okay.
I'll talk in the reverse, whatever questions you've said. First is, as I said, the basic principle is to get the calorie down, whichever diet you use. And not only that the proteins are less if you have only 2 meals, whether it's an IF or whether it's whichever name you want to give it to the diet, all are imbalanced. The protein, the carb, the fat, the fiber, and all other micronutrients also. That was your first answer. Second is, you should also look into what are we prescribing as nutritionists. As nutritionists, you know very well what you should do. Your NIN and your other books also know that which patient should have how much of vegetarian and how much of non-veg is allowed in that particular book. It's roughly 80 grams per day for a normal human being. I think that is what you should say for those who have it already, right? But otherwise, we have a lot of other plant proteins available wherein you can use vegetarian sources. So for example, it is milk, it is curd, it is paneer, it is chana, it is rajma, it is soy, right? It is quinoa. So these are those at least 9 to 10 options of vegetarian proteins where you could easily give it to them, and that would suffice.
Thank you, Dr. Altamash. Niti, would you like to add something regarding the fruits in the morning?
Yes, I think that's a very, very common practice actually, because some books of naturopathy tell you that you should be having fruits in the earlier part of the day before 12 o'clock. And a lot of people follow that. There are two issues. One is that the quantities, when you only have fruit for breakfast, the quantities go up. After all, fruit is fructose. A lot of time patients, so fructose has a direct effect, and in fact there's a big role it has to play in what Dr. Sheikh said, fatty liver. Also, most patients or people don't realize when we tell them that fruit has no protein, and they show great surprise. And they think fruits are free, fruits are healthy, fruits are natural, so they are free. Also, when you only have fruits, there is no protein, and breakfast generally, what works the best is a carb-protein combination. So all in all, we say fruit cannot be a meal. Fruit is to be had in between meals. So you cannot make a meal out of fruits.
Right. Thank you. And let's answer one or two more questions.
I would like to add here. As per your question, vegetarian and non-vegetarian food, there is no science as it is that you need to stop your non-vegetarian food. That's a personal preference, whether you are vegan or vegetarian or non-vegetarian. In all three categories, there are enough protein options. And little common sense is required to have a balanced meal. Your plate has to be balanced all the time. There has to be a portion of protein, a portion of carbs, and there has to be fiber for you. Now, the sources of these, that can depend on whatever kind of diet you choose. And your nutritionist can definitely help you work around your meal preferences. So there's no such hard and fast rule that you have to go vegan or vegetarian. Animal-based protein is absolutely fine to take, but the way it is cooked is important. I think Dr. Niti can tell you more about that.
Okay. I think we'll just answer one or two more of the questions. One of the questions is it normal to get periods for 8 days? Well, no, that's not normal. 3 to 7 is normal. And if there is a prolonged period, then you need to visit a gynecologist and have it checked. The next question is, what is the best day of the cycle for sonography to check the period? Madam, would you like to take that?
To check the period?
To check PCO.
PCOS. Yeah, ideally you must do the ultrasound around day 4, 5 or 6 of the beginning of your menstrual cycle. because that is the time the ovary is still not activated, it's not really producing an egg. It starts producing the egg from the 7th day onwards, which then grows and makes the ovary look bigger. So what we want you to do is do it on the 4th or the 5th or the latest by the 6th day of your first day of the period, from the time your cycle starts. That's the best time to look for polycystic ovarian morphology. Means it looks polycystic, and that is where we count the number of eggs we see in the ovary. They should be more than 10 to 12. This is with a routine ultrasound. But if you have a very sensitive ultrasound, the latest guidelines, the international guidelines say that you must have more than 20 eggs seen in the ovary when you can call it polycystic ovarian morphology. But most of the people still do 10 to 12 eggs because their machines are not so sensitive to pick up those 20 eggs.
Ma'am?
Yeah, one second. Let me ask one question online. I think somebody has asked what is the role of contraceptive pills. So Dr. Durusha Madam has already discussed this question, so we won't go back into it. Yes, somebody wanted to ask?
Ma'am,
yes.
I have a question for Aishwarya, ma'am. Ma'am, my name is Apeksha and I'm currently pursuing Masters in Sports Nutrition. So my question to you is, how is female athlete triad and PCOS related? And if yes, is there any specific sport, like female athlete triad is most common in gymnast or aesthetic sports? Yes. So how you deal with such kind of athletes?
That's a great question. Yeah, so what you all need to remember when we deal with athletes is that which phase of their sporting cycle they are in. That is, whether they are in their pre, mid, post. Mid, I mean, is whether they are competing at period of time, because stress plays a very big role. And when you are a sports physician, that is something primarily we need to consider, because PCOS is also related to the stress factor. So coming down to the question that I have just laid forward, female athletes are under a great amount of stress comparatively, because in our country, female sports is just rising. Them to get recognized is way more competitive, because it's just now that, you know, we are recognizing female athletes in the picture. And also with respect to their menstrual cycles, if a female athlete has PCOS problem, they are very high likely prone to have irregular menstrual cycles with respect to their ovulation. So if stress is equally added into it, I mean, you'll have to consider that, you know, we need to tackle it in a completely different outfront with which phase of their sporting event they are in. And also the other questions, that is nutrition, psychological aspect, you know, mentally dealing with them to calm them down, and exercise, that is whether if they are in their ovulatory phase when they are having hormonal disturbances, you cannot shoot them up with high level of exercise intensity. Because
okay, I think Aishwarya, I'd like to just add in a point here that with high, we call them elite sports women. And you know, this is the first year in the Olympics when the number of male and the number of female athletes was the same, which I think is fantastic. So as we have more women coming into elite sports, some of them suffer from REDS, relative energy deficiency of sports, and they have irregular cycles, and some of them suffer from PCO, and that PCO is perhaps caused by the stress, is what Aishwarya was saying, and that's a very, very interesting area to look into. And Madam, you would like to say something, please?
Yeah, I think a lot of athletes tend to, especially the cross-country runners or the ones who want to keep their weight very low. And when they keep their weight very low, basically there is not enough, you know, all hormones in the body, they start from cholesterol. So if you've got no fat in your body, like women who are now trying to get zero size, very thin, very thin, very thin. They hardly have any fat in their body. Hormones are not getting produced to the right extent. And therefore, they go into a phase of months and months of no periods. No periods. Every 4 months, they'll have a period, which is again a normal period, not as heavy. If it's heavy, it's another pathology. But this we see in young girls who are ballerinas, who are jockeys, who are female athletes, gymnastics, all those who want to keep their weight very low, and all the modern girls today who want to look like models and be very, very, very skinny, they are the ones having these problems with their periods. I think they need to introduce a little bit of fat in their diet, which will help their hormones to get better.
Yes, I think that is a very interesting thing, and I think now they're asking us to fill the post-event poll and to share the feedback. Is that what we are supposed to do next? Yes? Okay, we'll have the last 2 questions and then we'll go to the poll.
Pollution have a role to play in PCOS? Or, I mean, say like turning off and on of genes sometimes. So
we don't know, but we can't say that we blame it on the pollution.
Yeah.
Endocrine disruptors.
The risk factors of this, the risk factors of PCOS, if you see what happens, even the comorbidities. So if you're looking at obesity causing PCOS in a girl or a lady, we have clinical evidence that the AQI or the API, the air pollution index, and the particles more than 2.5 ms can cause it. Even for diabetes, we have published evidence with which we can do that. That's why we need clean air, and that's why the word gratitude comes for a lot of things when you treat PCOS, and we need to see that the area around our houses, the area around where we work is kept clean and green. One more suggestion is to put plants, those who give out oxygen with a higher concentration. So that can be another session altogether.
Okay. Yes, last.
Yes, ma'am, it was me. So my name is Rahila Khatri and I am from Masters Part 2 Sports Nutrition. And my question is for the entire panel that inositol supplementation is a very up and coming supplement or formula that is given to PCOS women. So what are your thoughts on it? Should it be continued or is it a good thing or not?
So it works both, Myro and D-Chiro both work more or less like metformin. So where we see that the girl or the lady is unable to tolerate metformin, in those cases then we give it. But however, if there is a severe or a classic PCOS with severe symptoms, then we give both in the start itself.
Thank you. Yes, last one question from the last row and then we close. Yeah.
That's the third last.
I know. But how can I say no?
No, but we need to get the poll done because we want to understand how much we were able to impart, how much knowledge.
So we'll have this last question, then we'll move down, I think, because otherwise they can see or can they see on the phone?
Do you all need to take the QR code again?
I think, madam, will go down and then they can do the... Finish. Go ahead.
Good afternoon, experts. My question is for all of you. Like, can you guys shed some light on the role of nutritional supplement and chromium picolinate on the management of PCOS?
One line answer, all nutraceuticals are adjuvant in treatment. You need to start with lifestyle modification and the actual drug which will help for that disease, for that particular lady, for that particular PCOS, for that particular indication, whether she wants to be pregnant or not pregnant. So we take it from there clinically. Thanks.
So you can't have only that. I think we're closing now and we'll all move down and we'll go for the poll. Yeah.
I think they've done a wonderful job. Can we have a nice thunderous round of applause, please? And I'll request Vishaka ma'am to please come and felicitate our moderator, please.
We'll all come in front.
Yeah. Vibha ma'am.
Thank you.
Healthy nutrition. Viva ma'am. Kamini ma'am. Fatima Kader ma'am. Anjali ma'am. Dr. Tasneem. Who has not been felicitated? Dr. Minelli. मैम को दिया मैम को दिया And I would also like to thank Mr. Bhavesh. So Mr. Bhavesh, will you please come forward? I have pestered him and pestered him and pestered him no end. And thank you for being patient enough with my pestering, for helping us to take this to the level to which we have gone. Protiti, please felicitate Jaya ma'am. Thank you once again. And yes, please do take that link, and the questionnaire is there. Please do respond to it. Thank you so much.
We'd also like to just thank Sneha for all her hard work.
Yes, of course.
Sneha, thank you.
Sneha ma'am. Vibha. Thank you once again. Please do follow the QR code, and I'd like to call upon Minelli ma'am to propose the vote of thanks. Yeah, take the plants back and put them in the bags. Yeah, one picture with the panelists, please. Vibha, Vishaka ma'am, come. Come, Minelli ma'am, come. Thank you. Minelli ma'am.
So we now move on to the concluding part of our session today. So no seminar is complete with this vote of thanks. So it is my great pleasure to propose the vote of thanks on behalf of the Department of Foods, Nutrition and Dietetics, Wellness, Fitness and Holistic Health Committee and Women Development Cell at College of Home Science, Nirmala Niketan. We would like to acknowledge the contribution of each individual in making this event a successful one. Firstly, a big thank you to PCOS Society of India. We are most grateful to our keynote speaker, Dr. Duru Shah, founder member of the society. Thank you, ma'am, for sharing your knowledge with us. I would also like to thank our moderator, Dr. Sarita Bhalerao, and all the panel members who participated in this excellent deliberation that we have had today. Dr. Duru Shah, Dr. Altamas Sheikh, Ms. Niti Desai, Dr. Sapna Bangar, Dr. Sunita Tagra, Dr. Aishwarya Chavali. Dr. Altamas has beautifully summarized it into 5 steps, so thank you, sir. I would also now like to express my profound gratitude to our in-charge principal, Professor Dr. Vishaka Karnad. I also wish to thank our management for their constant support, especially our manager, Ms. Noella Dias. Now I wish to thank the people who have been the backbone in organizing this seminar. This event would not have been possible without the leadership of our director, Dr. Yasmina Doddi-Avari, Ms. Viba Hasija, our HOD, Ms. Fatima Kader, the convener of the Wellness, Fitness and Holistic Health Committee, and Professor Dr. Kamini Rege, convener of the Women's Development Cell. Thanks to all the student volunteers who participated in today's program. Thanks to all those who have helped us with the AV setup and the hall arrangements. We also thank our sponsors, Philips, and nutritionist Kajal Bhatia from Plant Power for sponsoring the hampers for this event. Last but not the least, my deepest sense of appreciation to all the participants of this program, those who are present here, as well as our dear participants who are online. Thank you all. We are grateful for your participation in this session on PCOS today. Empowered with this knowledge, we are sure that you will generate awareness about PCOS among other people around you too. Thank you very much.